Hello everyone, my name is Stuart Dowling. I'm a PharmD candidate class of 2022, and this is my application presentation for Bennett Health in Wyoming. I hope you guys enjoy. I'll be going over the questions you guys sent me. Going over my first question is expectations of residency. I expect it to be very challenging but rewarding. With that being said, it is 3 years of work training combined into 1 year, which is very challenging because you're putting all that workload into just 1 year, but also very educational because I'll be going over all these different sites on the hospital, learning different types of pharmacy, especially clinical pharmacy knowledge that I'll be learning. In the best way someone's ever described it to residency to me is this the best year of life you never wanted to relive. Not that there's anything apparently negative about residency pharmacy, but it's just a very difficult and stressful year that people do enjoy it and people appreciate that they finished one, but they definitely don't want to relive what they did for the first year of residency. Going over my least and favorite rotations, easily my favorites would be Northside. I did a inpatient internal medicine rotation there where I rounded with medical students that were doing their residency training, and I was with a lead physician and a pharmacist. And with that rotation showing me that I was truly challenged. It was the true challenge I ever had in the rotation, just because internal medicine is so broad of a category to know. There's so many different types of medication, from antibiotics, anticoagulants, diabetic medications, insulin. You have to know pretty much everything. You kind of have to know they're right then and there during the rounds. It taught me the most, and it was the truly most challenging rotation. And for my least favorite was Morehouse School of Medicine, just because it was a virtual experience. I feel like I did miss a few opportunities working with the medical residents at Morehouse that I could have had if I was in person there. For my two greatest strengths, I chose adaptable and work experience. With adaptability, you have to be able to, especially with residency and my APBs I've had, is to quickly learn the job or the rotation you're doing right now, because you only have a few weeks, about a month of on this rotation, and to maximize how much you learn from it, you want to be able to learn the job quickly and effectively, just to get the basics out of the way of how doing the basics of the job, and so you can get to the more clinical knowledge and the more learning aspect of the rotation. And I feel like I've been very adaptable with my rotations at APBEs. I've been doing this past year or so. And my work experience, I have been a part-time intern doing my full-time students as a student of pharmacy school. And I've been working about 15 hours a week while in school, being a full-time student, putting studying in there, while also trying to cram these 15 hours of work and having a little bit of social life as well. You tend to be pretty good with how to manage your time with studying, work, and having a little bit of a social life. Not too much, but just a little bit. For my most influential preceptor, that was Dr. Barefield. She helped me a lot with helping me with my mid-year presentation. She helped me a lot with doing research. She was one of my one of my letters of recommendation, and she taught me a lot during her rotation with her at the ambulatory clinic. She taught me a lot about diabetes, and she even went beyond diabetes, which leads into my next question of what is good quality of a preceptor, and that would be going beyond a student's learning needs. So for her, Dr. Barefield, for example, she is a diabetes expert as ambulatory care setting. All she needed to tell me about the rotation was diabetes, that's it. But she went further because I asked for it, and I was willing to learn from her, that she helped me with how to do research, how to make a good presentation for mid-year, what topics to choose from, where I could get information from. And she also went further to talk about COVID-19 treatments and other chronic disease states that the clinic manages, like hypertension, dyslipidemia. So all she did have to tell me was diabetes, but she went further because I was willing to learn, and she saw that if she was going to put in effort, I would put in double the effort, and I did appreciate the opportunity she gave me. One of my more impactful interactions I ever had was with a patient I got to work with all by myself. I worked them up. I was able to talk to them in the room by myself using only my knowledge. and it was a patient on diabetes who was interested in starting insulin therapy. And she has so many concerns I had to address, like, oh, if I start insulin, I'm going to die on insulin, which is a common misconception because people who get on insulin can't get off insulin once they do make appropriate dietary changes and exercise changes that they need to do for their lifestyle. And kind of explain to you like some of the possibilities of like side effects, how we're going to be initiating insulin, how we're going to be titrating it, and what's insulin even used for. She had quite a few concerns and I was able to address them. We did not start insulin that day, but she was going to be more leaning towards starting insulin therapy in her next visit, next 3 months for follow-up on her diabetes. One of my more favorite questions you guys sent me was, which one do I favor more, clinical or interprofessional knowledge? And hands down, I would go with interprofessional knowledge, just because medicine is not a solo job. You can't know everything about healthcare in general. You can't be the social worker that knows everything about insurance. You can't be the pharmacist that knows everything about medications. You can't be the dietitian that knows everything about healthy dieting and different diets that are out there and which one's most effective for you depending on your disease states. With interprofessional, you'll be able to effectively communicate with different professions and get their different viewpoints on the patient's disease states and their indications. And of course, with the future of healthcare going forward, it is more and more interdisciplinary. It won't be just medical residents looking at the patient, just medical residents. It's going to be dietitians, like I mentioned, pharmacists are going to be more and more involved in the next few years. When I was rounding, I was going to pharmacist, and while doctors are great dietitians, pharmacists are there for the medication knowledge that we have because medical residents specifically don't know everything there is to medications and they do need our help for sure. And that's why I was thinking that when a professional, it's more effective to communicate with the experts than trying to be an expert in everything. This was one of my favorite questions as well, organizational style. And just because each one was so inherently negative, there wasn't a correct answer because each one just was not perfect on its own. And I did want to mention before answering this question that we don't all use the same exact style for every situation. Like if we, for example, if we all were to take out the trash, most of us would probably procrastinate just because, oh no, I want to take out the trash. But in terms of managing and working with a patient in like an internal medicine rounding scenario, we're all going to be as much detail oriented as possible. Not necessarily enough to be a perfectionist, but we do want to get close to that level. And the one I chose was allergic to detail, just because the others didn't fit me as well as this one. I don't like getting bogged into the details. I like to get all the information I need to, but nothing more than that when making a decision. Don't like getting into great detail. Some of the challenges I see in the field of pharmacy is the increased role of pharmacists. And what I mean by that is that pharmacists are getting more and more opportunities to do different things. For example, over the last couple of years in retail, we are able to give any vaccine that CDC recommended. The caveat to this, of course, is that with this, we have to be educated and trained on is this patient's recommend to get this vaccine. Are we giving this vaccine a week early than we should have? And just going over additional education and training is needed to fill this role, to do it effectively. So as pharmacists increase their roles and increase their hats, so to say, we need to increase our training and education along with that, and that could be a challenge. The test and treat reimbursement, there's been a hot topic going on if pharmacists should be allowed in the retail setting to give someone a test. If they test positive, treat them with one of the outpatient pills for COVID-19, specifically for Plaxavid. And there's a lot of pushback on that. I think it's a great idea. A lot of people, specifically medical doctors, don't like the idea of pharmacists prescribing. Only a few states allow pharmacists to prescribe specific things like Hawaii with birth control. And that's something I feel like pharmacists are going to become more and more involved in with prescribing under a certain collaboration or certain medications. And of course, burnouts, with anyone in the healthcare field is known, burnout in any profession has been increasing rampant and decreasing the amount of stress going on with the pharmacists in the healthcare setting is very important. So my short-term goals, of course, is completing a PGY1 residency. That's why I'm applying to you guys today. I want to get a residency and complete it. Depending on where I want to go to afterwards is to get some sort of board certification. If I stick with inpatient and do internal medicine, I want to be pharmacotherapy board certified. That will help a lot. If I want to do ambulatory care, I want to be diabetes certified and certified in education as well, just depending on where I go afterwards. After residency, I feel like if I like this one rotation, I'm just going to fall in love with the next one afterwards. So just trying to narrow it down after residency is going to be more difficult than I can think of right now. Because becoming established on a clinical team, I do feel like once I get established, I do want to build rapport with my team. I do want to have confident answers so they don't have to like, are you sure you've been wrong about that and that before? How confident are you? I want to be able to give confident answers that I'm not second guessing myself, my team's not second guessing themselves with me. And developing that rapport is very important with anyone. And the big question, why me for you guys? Why me for Wyoming Medical Center? Kind of just going over a few examples I stated previously. I communicate effectively to my team based on my work experience. I worked for a few years on a retail team, and all teams are very similar in terms of you got to be able to talk to each other in a timely manner. I have excellent time management skills just based on my experience of work, school, and retaining a little bit of a social life. You have to have really good time management skills. I have a huge willingness to learn. That's why I'm doing a residency. I don't know everything, of course, but I do want to learn as much as I can. And I'm highly motivated to complete and exceed a residency program. I really want to get into residency, and I'd be well more than motivated to complete it within this difficult year. That is the end of my presentation. I hope you guys enjoyed, and I look forward to hearing from you soon.